some of the symptoms that women may have around the time in perimenopause, they may notice definitely a change in their bladder control. So they may find that they've got urgency, which means you just need to get to the toilet really quickly. And for some women, they may have leakage of that urine, so they can't get there in time and they may leak a little bit. Definitely what you're saying with coughing, laughing, sneezing, being on the trampoline, you may leak urine then as well. You may find that you're going more frequently to the toilet, so your bladder's not able to kind of hold that urine like it used to. Some women around this time also get recurrent urine infections, and it's just infection after infection, and then they're just on antibiotics. When actually, that is the treatment if you've got an infection, but not looking at the underlying causes, which may be the fluctuations in the hormones. And then you've got also in that area, you've got the whole pelvic floor, which holds all of your organs up, holds up the bladder, holds up the bowels, holds up the uterus. And this starts to become a bit loose because of that lack of estrogen, because there's a huge number of estrogen receptors there. So it's quite sensitive to that drop. So everything becomes a bit looser. So those sphincters that keep the urine in the bladder, and that keep your uterus up and that hold the control of your stools as well, just become a little bit looser. So you may notice like you're not as good at controlling those sphincters, and you may start to get prolapses, and just in the vulval vaginal area as well, you start to get sort of the tissues become drier a little bit and then painful, and then women may have itching skin or pain during intercourse, or just like a discomfort down there.
Welcome to Midlife Answers. I'm Rachel Fortune. This is the podcast where we cut through the noise and focus on one real question at a time, sharing clear answers and practical next steps that fit into real life. Today's conversation is an important one, and it's far more common than most of us realise. Is bladder leakage or pelvic discomfort normal in midlife, or should I see a doctor? For many women, these changes can feel embarrassing or isolating, which means they're often brushed off, joked about, or simply endured in silence. But this is a necessary conversation, and it's not something anyone should feel ashamed of. I'm joined by Dr Sharma, a GP specialising in women's health, to help us understand what's common, what's not, and when it's time to seek support. It's great to have you here, Dr. Sharma. Thank you so much for joining us. So let's talk about bladder leakage and pelvic dysfunction. How common are these symptoms for women in midlife?
Definitely midlife, this is where things start to go wrong. And I think a lot of women, when they're younger, think that these are the things that happen when we're in our 60s, 70s. But actually, it starts in our when our perimenopause starts, and this is where things start to go wrong. So if you're starting your perimenopause a little bit earlier, it could start basically any time in your 40s, which then hits people with a little bit of shock.
And we're not prepared, are we?
Yeah, and we're not prepared. I think the other time that women may notice these symptoms is when they're pregnant or postnatally, when they've got, but then they understand that that's because of the pregnancy and the impact of that on their body. But and then they don't really think it's going to happen again until they get much older. So yeah, it can be a bit of a shock when they start around perimenopause. And I think about, I think about half of the women that go through perimenopause will feel these symptoms, and they'll feel them at the beginning, even before the periods have stopped or started to change. So again, that's another thing that women are thinking that maybe it'll start when I'm postmenopausal. But actually, it can start in perimenopause as well. Yeah.
Talking about the different types of bladder and pelvic discomfort, I don't think I'm alone in saying this. There's definitely been times when I've been running around after children. I've been on the dreaded trampoline where I've had to take a jumper off and put it.
Oh gosh.
And put it around my waist. That is something that I can deal with. I know when those situations are going to happen. But what about bladder leakage and discomfort, what we're not prepared for? And if those situations do arise, what do you recommend we should do going forward?
Yeah, so some of the symptoms that women may have around the time in perimenopause, they may notice definitely a change in their bladder control. So they may find that they've got urgency, which means you just need to get to the toilet really quickly. And for some women, they may have leakage of that urine, so they can't get there in time and they may leak a little bit. definitely what you're saying with coughing, laughing, sneezing, being on the trampoline, you may leak urine then as well. You may find that you're going more frequently to the toilet, so your bladder's not able to kind of hold that urine like it used to. Some women around this time also get recurrent urine infections, and it's just infection after infection, and then they're just on antibiotics. When actually, that is the treatment if you've got an infection, but not looking at the underlying causes, which may be the fluctuations in the hormones. And then you've got also in that area, you've got the whole pelvic floor, which holds all of your organs up, holds up the bladder, holds up the bowels, holds up the uterus, and this starts to become a bit loose because of that lack of estrogen, because there's a huge number of estrogen receptors there, so it's quite sensitive to that drop. So everything becomes a bit looser. So those sphincters that keep the urine in the bladder, and that keep your uterus up and that hold the control of your stools as well, just become a little bit looser. So you may notice like you're not as good as controlling those sphincters, and you may start to get prolapses and just in the vulval, vaginal area as well, you start to get sort of the tissues become drier a little bit and then painful. And then women may have itching skin or pain during intercourse or just like a discomfort down there in that whole kind of pelvic area. But these are all symptoms that people don't want to talk about. They don't want to mention to their doctors. They're highly, highly embarrassing, and they don't even mention them to their partners or even friends sometimes. So how do you kind of like, what do you do about it? I think if you don't mention these symptoms, you won't know about all the things that you can do to get help for yourself about these things, and you're just kind of missing out on all of that help. So please do talk to your doctors about it. They can help you. They can refer you to people. They can give you some treatments that can make an impact. And again, just write down your symptoms. Write down everything that you're feeling. Notice if other areas, if it's just bladder, but have a look. Are other areas around it? What's happening to my pelvic floor? What's happening to my vulval vaginal area? What's happening to that area? Have I got symptoms there as well? And because I think one thing that I see quite a lot is a lot of women not connecting recurrent urine infections sometimes around perimenopause with lack of estrogen. So it's something just to write all the symptoms down again and then present those as a whole, like this whole area. These are the things that are happening to me.
It is such a sensitive topic, isn't it? And I think you're absolutely right that we shouldn't be embarrassed or ashamed about it. But I think that embarrassment can be taken away if we go prepared, like you say, to write everything down. We're almost then reading from a script. You can take the awkwardness out of it if you're just reading off like words that are associated with that you're going through.
The other thing is to put the symptoms in context, as I mentioned before on other podcasts. But sometimes if you just go with a list of symptoms, it's hard to know how much that's impacting someone. So putting it into context of your day-to-day life, well, how does it affect you going to work? How does it affect your day-to-day life? Then that suddenly gives someone an idea of how these symptoms are affecting you. It makes it easier to know like how to help someone then.
That's really helpful. Okay, so not just giving off words, but like you say, give the context of these symptoms. That's really helpful. You mentioned also having these symptoms is to do with, well, can be to do with perimenopause. But what other things can make these symptoms arise during women in midlife?
Yeah, so I think it depends if you've had one of the first things would be if you've had kids before or not, and what your pelvic floor was like after that. I think a lot of women just do pelvic floor exercises just around pregnancy or after pregnancy, and then they just stop doing them. When actually we should really be maintaining that regular pelvic floor health to maintain those exercises to keep that pelvic floor strong. Because I think that's the start of when all of these problems happen. If you haven't had kids, again, as you head towards perimenopause, again, the lack of estrogen is going to impact those areas. Other things are chronic coughs, so people who cough a lot put pressure in that area. If you put on a lot of weight, again, that can put pressure on your pelvic floor. Your general exercise levels as well. If you're someone that's not exercising or not using that pelvic floor on a regular basis, so if you're inactive, then some people even don't even know where their pelvic floor is. So it's about kind of just looking at all these things that may put pressure on that area that may lead to like bladder symptoms and and going more frequently as well to the toilet and leaking and things, symptoms like that.
Just a quick one. If you love Midlife Answers and want to support what I'm building here, you can buy me a coffee or a green tea for people that know me. It helps with the behind the scene costs and means I can keep bringing you these honest midlife conversations. The link's in the show notes. Thank you. And then once you've identified those areas, be it exercise, weight management, or something more medical, you then seek out the professional that can help you in that area. Is that the right thing to do?
Yeah. Yeah. I think the first thing is to recognize your symptoms and then see how it affects you in your life, and then go and talk to the GP first. I think that's the first port of call, is going to talk to your GP and then looking at, maybe, do you need to be examined? Does someone need to check things inside or do any tests? And I think that that's really important first step. From there, then it's thinking about what can you do next to help the problem. And it depends, what's being affected. So if you're perimenopausal, then definitely thinking about localized vaginal estrogen, just specifically for that area. So that's not hormone therapy, that's just estrogen that's just used locally in that area. So even if you're someone who doesn't want HRT, then it's really beneficial to take care of the tissues in that area, to consider using local vaginal estrogen. And it comes in lots of different forms, in forms of creams, pessaries, gels, rings, so maybe you can find something that suits you as well. The other thing is to think about how you can maintain that pelvic floor long term. And it is about doing pelvic floor exercises. But I always find that if you send someone away and just do pelvic floor exercises without some clear guidance, they usually may be doing something wrong, where you end up going away and doing something in the wrong way. So I like to send my women to a pelvic floor physio, and they're specialised in taking care of the pelvic floor. And what they do is actually, if you've got a good one, then they'll examine you internally and they'll map out your pelvic floor, because actually some areas may be very, very tight, some areas may be loose, and everyone's going to have something different. So then they can guide you, and whilst you're being examined, they can guide you as well, as to where your pelvic floor is, what needs to be done, what exercises need to be done. And then you get that feedback that, yes, my pelvic floor is what is being tightened in this area or relaxed in that area. So they'll give you the right combination of exercises. I'm well aware that finding pelvic floor physio specifically for women's health can be a nightmare in some areas. Personally, my area, it can be so difficult. So I have private contacts that I send my patients to, and it may be just that you need one appointment, but it's so helpful to help you understand that area of your body, give you the right exercises, and it's not that you have to keep going to them. You may need to, but it's not too many appointments. So it's just that investment in yourself for your long term um, health, and to take care of that area in a really good way. And they can really, they'll also be looking at your core strength, they'll be looking at your pelvis, they'll be looking at how you walk and move, and how all of these things impact that area as well.
It's never even crossed my mind that there was a pelvic floor physio, but it makes sense that as you would go and see someone about your leg or your wrist or your back, whatever it might be, why shouldn't there be for a pelvic floor? So that is really valuable insight about, it's maybe the first step. And like you say, it doesn't have to be many appointments, it could just be the one, but at least it will set you off on the right path, so that going forward, you can treat it as something that isn't a shameful topic, and it is something that can be fixed. It's not something that you have to live with. And I think that's what's so important from this conversation, is that it's about normalizing it. It's about taking away the shame and embarrassment, but also reassuring women that we shouldn't suffer in silence. And as soon as we talk about it, there is help out there that we can take.
Yes, definitely.
You've given so much information, Dr. Sharma. Could you maybe just round up with one clear message that maybe someone can take away with them today about, if they're suffering from leakage or discomfort, what would be the first thing that they should do going forward?
I think recognizing the symptoms, don't be embarrassed. Please, please, please don't be embarrassed. This is There's stuff we deal with on a daily basis. Talk to your GP about it. Go and talk to them about it. Make sure someone checks you over and examines you properly. And then think about the treatment options and talk to them about it. Think about pelvic floor health, think about vaginal estrogen. If you've got, say, like I mentioned before, chronic cough, what are we doing about that? Can we manage that? Just thinking about the things that are contributing to it, and maybe you might need to go away and do some bladder training exercises. There's lots of things. There's whole clinics for things like this on the NHS. So there are people that out there that can help. So just don't suffer silently. That's all.
That is fantastic. And like you say, it is available on the NHS, so I think is a really important message to put out there as well, that it is accessible for all. We just need to talk about it, and we just need to go and get help for it.
Yes, absolutely.
Thank you so much. Post-recording, Dr. Sharma and I chatted about how she actually gifts pelvic floor physio appointments to her girlfriends, particularly to those who have just given birth. What a brilliant idea. I know exactly what I'll be gifting my girlfriends for their birthdays from now on. It's such a practical, thoughtful way to support women's health, and it really got me thinking about how little acts like this can make a big difference. If there's one thing to take away from this episode, it's that noticing changes in your bladder or pelvic health early and taking them seriously can completely change your experience. These symptoms are common, but you don't need to push through in silence, and you certainly don't need all the answers before reaching out for help. Whether it's talking to your GP, exploring pelvic floor physiotherapy, or considering localized vaginal estrogen, there are real solutions that can make a difference. A huge thank you to Dr. Sharma for helping to shine a light on something so often brushed aside, and for giving women the tools to feel empowered rather than embarrassed. For those of you who've been following Midlife Answers, you might recognise Dr. Sharma from previous conversations where we've explored other perimenopause topics. The links to those episodes are in the show notes if you want to hear more. If you found this episode helpful, you might like to follow or subscribe to Midlife Answers and share it with someone who could use a bit of reassurance right now. And if you'd like to support the podcast, a coffee or green tea really helps me keep these honest, practical midlife conversations going. The link is in the show notes. Thank you so much for listening today. Please join me next week when I'll be talking to therapist Suzette about resentment within relationships. Yep, that's right. I'm sure so many of us can relate to this. And it's how to notice it before it quietly impacts your well-being. I can't wait to share that conversation with you.